This video we're going to look at dexamethasone, its uses, warnings, interactions, and side effects. So what is dexamethasone? It is a glucocorticoid medication used to treat inflammatory conditions such as arthritis, ulcerative colitis, psoriasis, blood or hormone disorders, allergies, inflammatory eye problems, lupus, and breathing problems. It is also used in the treatment of cancer, immune system disorders, and as a test for adrenal gland disorder, that is Cushing's syndrome. Warnings: dexamethasone should not be given to patients who are hypersensitive to it. It should not be given to patients with systemic fungal infection, cerebral malaria, and also patients receiving immunosuppressive doses of dexamethasone should not be given live or attenuated vaccines during the course of treatment. Also note that long-term use of dexamethasone may result in thrush, bone loss, cataract, easy bruising, or muscle weaknesses. And lastly, note that dexamethasone can weaken your immune system, making it easier for you to get an infection or worsening an infection you already have or an infection that you had recently. Interactions: dexamethasone can interact with a number of medications. So before you start taking this medication, inform your doctor if you're under any type of medication, vitamins, or herbal medicine. The most common interactions is between dexamethasone and antibiotics or antifungal medications, birth control pills or hormone replacement therapy, insulin or oral antidiabetic medications, medication used to treat dementia or Parkinson's disease, blood thinners such as warfarin, Coumadin, Gentoven, and non-steroidal anti-inflammatory drugs, that is NSAIDs, for example, aspirin, ibuprofen, naproxen, celecoxib, diclofenac, indomethacin, meloxicam, and so many others. Side effects: dexamethasone can cause allergic reactions such as anaphylactoid reaction, anaphylaxis, and angioedema. It might cause dermatological effects such as acne, allergic dermatitis, dry scaly skin, impaired wound healing, increased sweating, rash, thin fragile skin, thinning of scalp hair, and urticaria. It may cause cardiovascular effects such as bradycardia, cardiac arrest, cardiac arrhythmias, cardiac enlargement, circulatory collapse, congestive heart failure, fat embolism, hypertension, hypertrophic cardiomyopathy in premature infants. It can cause edema, pulmonary edema, tachycardia, and thromboembolism. It may cause gastrointestinal effects such as abdominal distension, increased appetite, nausea, pancreatitis, peptic ulcer with possible perforation and hemorrhage, perforation of the small and large intestine, particularly in patients with inflammatory bowel disease. It may also cause ulcerative esophagitis. It may cause musculoskeletal effects such as loss of muscle mass, muscle weaknesses, osteoporosis, pathological fracture of long bones, steroid myopathy, and tendon rupture. It may cause neurological or psychiatric effects as well, such as convulsions, depression, emotional instability, euphoria, headache, insomnia, mood swings, neuritis, neuropathy, personality changes. It may cause ophthalmic effects such as glaucoma, increased intraocular pressure, and blurred vision. It may also have endocrine effects such as decreased carbohydrate and glucose tolerance, hyperglycemia, glycosuria, increased requirements for insulin or oral hypoglycemic agents in diabetes, manifestation of latent diabetes mellitus, menstrual irregularities, suppression of growth in pediatric patients. So if your child is not growing and is under dexamethasone, inform your healthcare provider immediately. It may also cause other side effects such as abnormal fat deposits, decreased resistance to infection, hiccups, increased or decreased motility and number of spermatozoa, malaise, moon phase, and it may also lead to weight gain. So that's it for this video. Thank you so much for watching.